And the effect it's having on women's mental health.
Yeah, according to a new study from the JAMA Network, women aged 18 to 44 who are living in states that banned abortion reported a 10% increase in mental distress after the Supreme Court overturned Roe v. Wade last year. The data is adding to researchers' concerns that the loss of abortion rights will contribute to the ongoing mental health crisis in the U.S.
For more on this, let's bring in Kelly Kitley, psychotherapist, licensed clinical social worker, and author of Myself. Good to have you with us. So what are the main takeaways from this study? And I want to reemphasize this stat that Stephen just mentioned. 10% increase in mental distress among women ages 18 to 44 who are living in states that banned abortion.
Yeah, absolutely. Thank you so much for covering this topic. It's really important. And with the ban of abortion, with the overturn of Roe v. Wade, many women who cannot access abortion in their state are feeling increased anxiety, increased depression, increased substance use, which is actually putting harm on the mother as well as the unborn child.
And let's talk about the ramifications here for mental health, specifically for women of color. Talking about the mental health resources that these women have already for marginalized groups is such a problem in the United States. When you add this on top of it, just exactly what are they dealing with?
Thank you. I mean, it is disproportionately separated in terms of women of color maybe not being able to access mental health care or have affordable contraception. And so the distress that they might be feeling in terms of partner violence as well, financial insecurity, and not being able to get the medical care that they need is really problematic.
So for those who are experiencing this increase in mental distress because of this, what are your best tips? What are the best ways to deal with that?
It is so important to check in with any kind of daily functioning of, many women are feeling ashamed and might not want to leave their home and be seen out in public pregnant, and depression breeds in isolation. So it's really important to reach out to a doctor, or there are lots of community mental health agencies in some of these states where women can access mental health care.
And that's one of the biggest challenges, maybe, that women don't realize that the resources are out there. But there are options. There's always something, even if money's an issue, right?
Absolutely. There are free or low-cost services that women can access. And sometimes there's waiting lists. But being able to make that first step is the hardest but most important piece.
All right. We want to make the note here. If you or anyone you know is struggling, you can call or text the Suicide and Crisis Hotline at 988. Kelly Kitley, thank you so much for joining us for this important conversation. We appreciate it.
Well, coming up this morning, a startlingly close flyby this weekend.